Now also you asked me the question about Dr. Mercola, who found that something in milk causing autoimmunity. It is very well accepted in the field of immunology that some milk peptides, their structure is very similar to islet cells. Islet cell making insulin. So when we make antibodies against milk, those antibodies plus helper cells attacking the islet cells and inducing autoimmune disease, the islet cells are destroyed due to autoimmune reaction, and children or patients are ending with diabetes. Similarly, we know that milk and wheat has similar structure with nerve cell antigens. In another article, which I have to give you a copy, published in the journal called Nutritional Neurosciences, clearly I demonstrated that a peptide of 8 amino acids in wheat, or component of gliadin, cross-react with human brain cells, therefore explaining the mechanism behind gluten-induced autoimmune disease, or a disease called gluten ataxia, meaning neurologic disease or brain dysfunction or autoimmune brain dysfunction induced by a component of wheat, in this case 8 amino acids. We call it gliadin peptide. So therefore, the mechanism of action is described in many articles published in scientific journal, where infectious agents, xenobiotics, and dietary peptides and proteins can induce autoimmunities, and children with autism are not excluded from that.
When you say xenobiotics, it's just
Xenobiotics is a general terminology for toxic chemicals. Any chemicals from the environment have toxic effects on the immune system. We call them xenobiotics. And mercury absolutely is a xenobiotic. Ethyl mercury is a xenobiotic, and therefore we should not have it in our vaccines.